Today, let's delve into the world of nasal polyps. We're going to explore what they are, how they develop, and why they can cause so much discomfort. Nasal polyps are those soft, often painless, teardrop-shaped growths that can quietly develop inside your nose or sinuses. They're like little sacs of swollen tissue that hang down, sometimes obstructing airflow. They're not cancerous, so there's no need to panic, but they can make breathing difficult, disrupt your sense of smell, and generally make life uncomfortable. Imagine constantly feeling like you have a stuffy nose. That's the reality for many people with nasal polyps. Polyps are essentially swollen, inflamed tissue, a reaction to chronic irritation. Think of them like a blister inside your nose, but instead of being filled with fluid, they're filled with inflamed tissue. They often appear yellowish, grayish, or even pinkish in color, depending on the level of inflammation and the specific tissue composition. This discoloration is a visual cue that something isn't quite right within your nasal passages. Because they're soft and lack nerve endings, you might not even notice them at first. They grow slowly and silently, often without causing any pain or immediate discomfort. Think of them as silent squatters, gradually moving in without announcing their presence. They're slowly but surely taking up valuable space in your nasal passages, impacting airflow and potentially affecting your sense of smell and taste. The lining of your nose, called the mucosa, is a delicate membrane designed to protect your airways from dust, allergens, and other irritants. It's a crucial part of your respiratory defense system. However, chronic irritation, often due to allergies, infections, or other inflammatory conditions, can cause it to swell and, over time, form these polyps. These growths often appear in clusters, resembling a bunch of grapes hanging inside your nasal cavity. As they grow, they can obstruct the nasal passages, leading to congestion and potentially blocking one or even both nostrils. It's important to remember that polyps are not tumors. They are benign growths. They're simply an overgrowth of the mucosal lining, a consequence of long-term inflammation and irritation within the nasal cavity. Imagine a garden hose with a persistent leak, constantly dripping water onto the surrounding area. Over time, the ground becomes saturated and eventually it bulges and swells from the excess moisture. Similarly, constant inflammation acts like that persistent leak, causing your nasal lining to swell and gradually form polyps. They can range in size from tiny, almost imperceptible bumps to large, obstructive masses that are big enough to block your nose completely, significantly impacting your breathing and quality of life. This blockage can lead to chronic congestion, making you feel like you have a never-ending cold, constantly battling a stuffy nose, and a diminished sense of smell. It's crucial to understand that polyps are a sign of ongoing, underlying inflammation, not something that appears overnight. They are a symptom of a deeper issue within your nasal passages. Understanding this chronic inflammatory process helps explain why treatment focuses on controlling the inflammation itself, not just surgically removing the polyps. Addressing the root cause is key to long-term relief. Have you ever wondered why some individuals develop nasal polyps while others remain unaffected? It's a question that many people ask, and the answer lies in understanding the complex interplay of factors that contribute to their formation. The primary culprit behind nasal polyps is chronic inflammation within the nasal passages and sinuses. This persistent inflammation sets the stage for polyp development. Normally, inflammation is a beneficial process, helping your body heal from injuries and infections. It's a natural defense mechanism. But when inflammation becomes chronic, lingering for extended periods, it can cause significant problems, including the formation of nasal polyps. The prolonged irritation leads to tissue changes and polyp growth. Chronic rhinosinusitis, a condition characterized by nasal lining irritation and inflammation lasting for more than 12 weeks, is a major trigger for nasal polyps. The constant irritation promotes polyp development. This prolonged inflammation is a significant factor in the development and recurrence of these growths. Respiratory conditions like asthma and allergies, especially allergies to airborne molds and other environmental allergens, are common culprits in triggering this chronic inflammation, as both conditions cause similar types of airway inflammation, further increasing the risk. Sensitivity to aspirin or other NSAIDs, non-steroidal anti-inflammatory drugs, can also lead to the development of nasal polyps in some individuals due to adverse reactions. Cystic fibrosis, a genetic disorder that affects multiple organ systems, thickens mucus secretions and clogs the sinuses, creating an environment that makes polyp formation more likely. The stagnant mucus and inflammation contribute to the development of polyps. Certain immune system disorders can also weaken the body's defenses and make you more susceptible to chronic inflammation and polyp development. Genetics and family history also play a significant role in predisposing individuals. If your close relatives have a history of nasal polyps, your risk of developing them is statistically higher. It's rarely attributable to just one single cause. Usually, it's a complex interplay of genetic factors, environmental exposures, and underlying health conditions that contribute to polyp formation. The common thread that ties all these factors together is persistent inflammation within the nasal passages. It's an inflammatory response that your body struggles to regulate and effectively turn off. Therefore, effectively managing that underlying inflammation is absolutely key to both preventing the development of nasal polyps and successfully treating them once they've formed. How do you know if you have nasal polyps? It's a question many people ask when they start experiencing persistent nasal issues. Nasal polyps can significantly impact your quality of life, so recognizing the symptoms early is crucial for effective management. The signs are often hard to miss, though they can sometimes be subtle at first. It's important to pay attention to changes in your nasal passages and breathing patterns. The most common symptom is a stuffy, blocked nose. This congestion isn't like your everyday cold. It's more persistent and doesn't clear up easily. It's a stuffiness that lingers and doesn't improve for months, becoming a constant presence in your daily life. This prolonged congestion is a key indicator that something more than just a simple cold might be at play. You might start breathing through your mouth, especially at night, as your nasal passages become increasingly blocked. This shift in breathing can lead to other uncomfortable symptoms. This mouth breathing often leads to dry mouth and snoring, disrupting your sleep and potentially affecting your partner's sleep as well. Polyps can also cause a reduced or lost sense of smell and taste, which can significantly impact your enjoyment of food and everyday experiences. This loss of sensory pleasure makes food bland and life less enjoyable, turning meals into a chore rather than a pleasure. The absence of familiar aromas can also affect your overall mood and well-being. This happens because polyps physically block airflow to the smell receptors located at the top of your nose, preventing odor molecules from reaching them. A constant runny nose or postnasal drip is also a common complaint, adding to the overall discomfort and irritation. The persistent postnasal drip often leads to frequent throat clearing, as you try to relieve the constant tickle and irritation. You may also feel pressure or fullness in your face and forehead, a sensation that can be quite uncomfortable and distracting. This pressure can sometimes be accompanied by headaches, adding another layer of discomfort to your daily life. Furthermore, your voice might sound more nasal or muffled than usual, affecting your ability to communicate clearly. It might feel like you have a permanent cold, with all the associated congestion and discomfort, but without the relief of knowing it will eventually pass. Frequent sinus infections can also occur as a result of nasal polyps, further complicating the situation. This is because polyps block the natural drainage pathways of your sinuses, creating an environment where bacteria can thrive and cause infections. If you're battling repeated sinus infections despite treatment, it's essential to consider the possibility of nasal polyps. In such cases, polyps could very well be the underlying cause, hindering your body's ability to fight off infection effectively. These symptoms, when experienced together, paint a clear picture of a nasal system that's significantly blocked and inflamed, signaling a potential problem. If you consistently notice these signs, especially if they persist for more than a few weeks, it's definitely time to seek professional medical help. Don't ignore persistent congestion. Your nose is trying to tell you something important about your health and well-being. Early diagnosis and treatment can make a significant difference in managing nasal polyps and improving your quality of life. If you have these symptoms, see a doctor for a proper diagnosis. Your doctor will ask about your symptoms, medical history, and any related conditions like asthma or allergies. Next, they'll examine your nose using a lighted instrument or a nasal endoscope, a thin tube with a camera. This allows them to see polyps directly and assess their size and location. Sometimes a CT scan is needed to get detailed images of your sinuses, especially if surgery is being considered. Allergy testing may also be recommended to identify triggers. All these steps help your doctor create a personalized treatment plan. Don't guess, get a clear diagnosis. Early detection leads to better outcomes. Your doctor is your partner in managing nasal polyps. The good news, there are many ways to manage nasal polyps. The main goal is to reduce inflammation. Start with nasal rinsing using saline solution to clear out irritants and soothe your nose. Daily use of nasal corticosteroid sprays can shrink or eliminate small polyps over time. For severe cases, your doctor may prescribe a short course of oral steroids to quickly reduce swelling. Afterward, you'll likely continue with nasal sprays to maintain results. Managing allergies with antihistamines or treating infections with antibiotics may also help. New injectable medications called biologics target specific inflammation and can be life-changing for tough cases. The right combination of treatments is different for everyone. Consistency is key. Stick with your plan for the best results. Work closely with your doctor to find what works for you. Sometimes medications aren't enough, and surgery becomes necessary. Surgery is considered when polyps are large, block breathing, or cause frequent infections that don't respond to other treatments. The most common procedure is functional endoscopic sinus surgery, FES, done through the nostrils with no external cuts. The surgeon removes polyps and opens sinus pathways to restore airflow and drainage. Surgery isn't a cure. Polyps can return if inflammation isn't controlled. Post-surgery care with rinses and sprays is essential to keep your nose clear. Surgery clears the path, but ongoing care keeps it open. You don't have to live with constant nasal discomfort. There are real solutions. Whether it's home care, medication, or surgery, you can breathe easier and enjoy life again. The first step is getting a proper diagnosis from a doctor or ENT specialist. Stick with your treatment plan and manage underlying causes like allergies. Even after surgery, daily care makes a big difference in preventing polyps from returning. You're the most important part of your healthcare team. Your actions matter. Take that first step, ask questions, and commit to your health. Clear breathing and a better quality of life are within reach. Start your journey today.